I'm going to give you a squeeze here, breathe deep. Okay, so she's symmetrical across the shoulders and good symmetrical chest expansion. And while I'm on the back side here, I'm going to see if I can elicit any CVA pains. I'm just going to hit you on the back here, Lindsay. Tell me if it hurts. Does that hurt?
No.
Good. Going to listen for breath sounds on the posterior chest, 5 points. Breathe. In and out. Okay, so we auscultated 5 levels. I'm going to come around the front here, and I'm going to look at her trachea. It's midline. I'm going to palpate carotid pulse. She's got a carotid pulse on both sides. Okay. What I want you to do is shrug your shoulders again. Okay. Take a deep breath. Okay. Again, nice symmetrical chest expansion. Going to listen, auscultate for breath sounds at 5 levels. I'm going to auscultate for bruit over the carotid arteries using the bell of the stethoscope. And all I can hear there are heart and breath sounds. I'm going to establish range of motion and strengthen her neck. So I want you to put your head back, touch your chin. If you look at me, to the side, other side, shoulder, shoulder. And I'm going to provide resistance. Push, 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 push.
Oh.
Clench your jaw. I'm going to try to push down. Good. I'm going to check for TMJ. Clench. Okay, open. Okay. Move your jaw side to side. Any pain when you do that at all?
No.
Okay, good. Try to open your mouth. Okay, good. All right. I'm going to still concentrate on her shoulders here, range of motion. Put your arms out. Put them up. Down. Side. Around back. Around front. Shrug your shoulders. Okay, hold your arms out. Do some resistance here. Down, up, out, in, and your elbows. Push, pull. Good. Going to look at the wrist real quick here. Palpate the joint. Don't feel any deformities. Don't feel any deformities. Radial pulse. Brachial pulse. Radial pulse. Brachial pulse. Okay, hold your arms up. Up, down, up, in, round and round, backwards, this. Decent, good. Okay. What I want you to do now, Lindsay, is lay back on the table. Quickly, I'm looking at her jugular veins. I do see some pulsation. If I had a tilt table, I'd tilt her head up somewhat until I didn't see any pulsations, and then I would record that angle. The angle of the table. I'm going to listen to some heart sounds here. Using the diaphragm, starting at Erb's point, and I would do this for 15 seconds at each place, but I'm going to just move along here because the camera's going to run out of batteries here. Okay. And I'm going over the aortic valve, the pulmonic valve, tricuspid, and mitral valves. And all I hear are S1, S2 sounds. Okay. Using the bell of the stethoscope, I'm going to listen over her aorta. I don't hear anything. I'd also at this point, if she's never sure on inspect her abdomen, it is soft and flat with no protrusions and no pulsations. So right now what I'm going to do is start off, I'm going to listen to her abdominal Going to auscultate her abdomen, the 4 quadrants, starting with her right lower quadrant. Right upper, left lower. I hear good vowel sounds. I'm going to percuss in each quadrant 3 points using the zigzag pattern. Good. Okay. Turn your head to the right and head to the left. Okay. Why don't you sit up? Move forward. Okay. What I want you to do is lean forward for me. Exhale and hold your breath. Okay, listening from